Hi, welcome to my channel. Come on in, have a seat, let's talk. Today we are about to talk. Imagine you go to the emergency room, the one that's close to your house, and when you get there, you went there because you are in excruciating pain. You are in severe pain, like you don't even know what else to do besides going to them because that's the only place you know that can help you with that type of pain. And when you get there, you are being told that this is all in your head. There is nothing wrong with you. Like, kind of like, pack your bag, go back home. There's nothing wrong with you. I've been in healthcare for over 20 years. I've seen, heard, witnessed a lot of things. A lot. This is why you need to educate yourself. You need to know your body. You need to know what's wrong. You need to be able to explain to anyone what the issues are. We're gonna do a series of video on some of the things that you must know. You must know. When you go to the emergency room, you need to have those information. You need to, don't let people fill in the blank for you. You need to fill in the blank for yourself. This is your body. You the one that needs to speak for yourself. And if you don't, someone else will. And it may not be always be the best to have other people make decision for you when you are well capable of making certain decision by yourself. I have a lot of examples to give you today. A lot. There is a big issue with telling Black folks when they go to the emergency room or they go to wherever they get their care from, urgent care, whatever, they get a dismissal card that comes to them and say, like, what you got going on here is, you're fine. You don't really have much going on here. Unfortunately, you may be like, well, I'm Black, I've never faced that before. You may not, but somebody else may have. So I'm talking to that person who have faced that before and the one that will face it tomorrow or the day after. So let's have this conversation. It's important. This is something I've been wanting to talk about for a long time. A long time. Like, for example, remember there was a study about syphilis back in the day? And Black people have always been the unethical medical practice for years in many countries. It's not just here or there, it's almost everywhere. And this is why we need to do the best that we can to know ourselves, know our medication, know our body, know, what's wrong with us. Just have the basic information for us. I remember talking to one of the nurses that I work with. She's Caucasian, and she was telling me how in Louisiana, where you know how many Black people live in Louisiana, there's a lot of Black people there. So the hospital she was working at, they decided if you have 2-3 kids after you have a baby, they automatically will cut your tubes so you won't have another baby. But guess what? The patients had no idea. No one told them, no one informed them, they didn't sign no consent, they have no idea that this was gonna happen to them. I'm sure it's a shocker to them that they have 2 kids and now they can't have another one if they wanted to, just because of somebody else's opinion, like, or decision, who made the decision for them that, hey, you have 2 kids, that's enough. We don't need any more of, I guess, you around. You enough. So This is why we need to be well informed and well aware. I'm not sure if you remember when COVID was around. If you remember, there was a lady, she's a doctor. Go figure. She's a doctor. Her name was Dr. Susan Moore. Dr. Susan Moore was a black physician. She ended up dying from COVID. Um, she died because she was in a lot of pain, and everyone she encountered, they dismiss her pain, they dismiss everything she was telling them, and she ended up dying because of, you know, she's just another black woman, like, who will take her serious. Okay, let's take another example. Serena Williams. Everybody knows Serena Williams. She's one of the famous tennis player. Remember when she had a baby, she had a blood clot in her lungs, and she was telling everybody who was taking care of her that she did not feel normal. Something was wrong. This feeling that she had prior, thank God she had experience with that. So she understood, like, if she's having the same, this is what I mean when I say to know yourself, know your body, know when something is not right, know when something is wrong. So she understood that if I had these experiences before and she's having them again, that means this is something that needs to be addressed right away. And yes, the staff, medical staff, they dismissed everything she was saying until she insisted and finally got one person to listen. And sure enough, when they did the test that needed to be done, they found out that she really had a blood clot. So this is why you and I, we have to be so mindful. We can't just take people's word. We can't just like let people just come and say, oh, this is what. No, we gotta make sure we on the same page. Take your time to think about what was said to you. Sometimes you can ask for permission to record what was said or write it down, go with somebody else, because when you go into the motion, you may not remember everything that was said or understand everything. And if you, like me, English is not your first language, you want to have somebody who can, like my kids, I'll have them there any minute because I know they understand this language. They can help me, out. And if there's something I don't understand, they'll help me. So if you cannot advocate for yourself, you need to have somebody to advocate for you. This is why it is crucial. When I say crucial, because I know someone who just lost a 39-year-old. 39, 40. She was 40. Same thing, exact same thing. She's a black woman in healthcare. Like she went to the same place. That's another thing we gotta discuss. If you have an issue, you have a problem, you can't go to the same hospital 5, 6, 7 times until you go one last time and end up dying at this same hospital that you've been going to so many times. Get another opinion. Go see somebody else. Go to a different hospital. Sometimes they miss. I remember someone went to a hospital in one city and then they couldn't help her. And, things didn't turn out well for her. So she ended up coming to the city where I'm at. And now she's doing very well because she went and got a second opinion. It is important for you to know what you need to know about yourself. Like, have the basic knowledge of, when your surgery, the medication you take, how did you feel beforehand, how you feeling now, what's new, what's different, what wasn't there before. So it's crucial that we do that for ourselves. And one of the things that Dr. Susan Moore did at the time that gave everybody an insight was the fact that she recorded everything. Everything was recorded somewhere, whether you write it down, whether you have a voice recorder, whether it's a video, whatever it is, but everything was somewhere where people can go back and listen or see what this is what transpired, this is what happened that day, this is what I was told, this is what was said to me, this is how maybe at some point, they may come to term that, we got to do better. Every patient that I take care of is a VIP patient for me, every single one of them, whether they're white, black, I don't care what color they are. These are my patients. I take care of you like I would take care of my own mother, my child, myself, because you're my patient. And I don't understand, it is beyond me that there are people in healthcare, they don't see it like that. They don't feel the same way. I guess everybody's in it for different reasons. So one of the things that we must do is we must educate ourselves. Educate ourselves about the simple things, like they say you take aspirin. Well, you need to know how many milligrams you take. What are the side effects that can happen to you? What can you eat? What you're not supposed to eat? What are you supposed to eat? What medication should not? At least the least you can do for yourself is educate yourself about your present moment. So the meds you on, the type of diet you on, your past medical history. Like if they said you have high blood pressure, well, you need to figure out, educate yourself. Now with the internet, there's everything online. You need to figure out what you should be eating, what you should not be eating, what can you drink, what type of exercise you should be doing, or whatever it is. You need to take the time to educate yourself, because this is crucial. Education is key, and that's one of the main things you can do for yourself. It is very crucial. It is very crucial that you do that for you. You do that for, it's gonna help whoever's gonna take care of you, it's gonna help them too. And you look different when you know your body, when you can give a complete history of yourself. You look different. It's like, oh, you actually take the time to know what's going on, because you can, even if you can't now, you can talk to Google. You don't even have to, if you don't know how to read, you can talk to Google. So I don't even need to tell you how important it is to know those things. After this video, I'm pretty sure you're gonna take the time to do this for yourself. And to my fellow healthcare people, I feel like you should do your very best to care for everybody the same way. Give everybody the VIP treatment. It shouldn't be because this is the president that's coming, they get a better treatment than Miss MJ. Miss MJ is a person just like the president. And you don't know. Maybe when you take care of other people the same way you would want to be taken care of, when your family members come to the ER or to wherever, they'll get taken care of the same way too, because there's a thing called karma. So that thing, it really exists, and it follows people around. So whether it's you, whether it's your loved one, whether it's somebody you know, whether it's somebody you don't know, it doesn't matter. Give them all the same care. And I hope and pray that one day we can get a healthcare system in America and everywhere on this planet that is not biased, a healthcare system that listens to every patient's problem, complaints, whatever it is that they brought with them, a healthcare system that believes what you said is your truth. It's not what the healthcare provider think, but it's what I'm telling you as a patient. You should listen to what I'm telling you and believe what I'm telling you, because I know myself and I know my truth, right? And when all that happened, I believe we as a people, as a nation, as the whole planet, will be completely healed. Thank you so much for listening, watching my video. I hope you like it. Give it a thumbs up, or you can comment, say whatever you want. It's okay. I'm open. We can have a discussion about what you think of this video. And I hope you are blessed beyond measure. Have a great week, weekend, night, day, whatever it is that's coming to you. Take care, everybody. See you soon.